pardon me for understating their level of commitment. They were so committed, they committed to it twice. But, Mr Speaker, as of when we went to the election at the end of last year, did we see a brick or any mortar? Did we see any evidence of anything on the ground? No, we did not. We actually delivered the funding. We actually delivered the construction. We actually delivered a comprehensive cancer centre for the good people of Darwin so that in the future they don't have to travel all the way to Adelaide to receive their cancer services. That's what making a difference is all about. Not just making a speech prior to an election, prior to the previous election when he was also Health Minister, and hoping that people will just forget about it once he's captured the headline, because that's the overall important thing in life for the Leader of the Opposition. Capture the headline and hope that someone else picks up the detail. Mr Speaker, he also made reference to that PET scanner at Royal North Shore Hospital. Now, we're advised by the local doctors, that in fact they started making representations in 1997. And the local doctors could not get the member for North Sydney to even organise a visit to the hospital by the Minister for Health. 1997, 98, 99. But when did they finally visit the Royal North Shore Hospital? I'm told it was in that magical year 2007. I'm told it was pretty late in the year 2007 because a particular event was looming called an election. And, Mr Speaker, we have funded that PET scanner. We are proud to have done so. And again, it makes a difference on the ground. Mr Speaker, the Leader of the Opposition has raised questions about the health and hospitals network put forward by the government. Our plan is very straightforward. It is for a new national health and hospital network, for the first time funded nationally and run locally. Mr Speaker, the Leader of the Opposition, said, "How dare you consider such a plan? How dare you consider such a possibility?" When I certainly remember a Leader of the Opposition in the 4 to 5 years that he was Minister for Health saying the Commonwealth government should take over the system. Now, Mr Speaker, did I get that right or did I get it wrong? Well, the Minister for Health as he was, now the Leader of the Opposition, nearly 5 years as Health Minister to act on this matter of deep conviction, because we all know that Tony is a straight-talking politician. We all know that he is a conviction politician. And then when he says the Commonwealth should take over the health system, you know for sure he's going to be a man of action and do it. Only 5 years later, nothing happened. And now the position he occupies is that, in fact, this government is doing the wrong thing by becoming the dominant funders of the system. Mr Speaker, funded nationally, run locally through local hospital networks across the country so that clinicians, doctors, nurses and others can have a major role in the management of the system. And on top of that, again, Mr Speaker, what we did the other day was an announcement to deal with the massive shortfall in the delivery of doctors, specialists and GPs across the nation. Mr Speaker, an investment in 6,000 more doctors. That is action, Mr Speaker. When the Leader of the Opposition was Minister for Health, do we know how many times he received warnings about the workforce shortage in health? Not once, not twice, 3, 5, 7, altogether some 23+ warnings when he was Health Minister about the looming crisis in the workforce in the Australian public hospital system. Mr Speaker, a national health and hospitals network, funded nationally, run locally, and for the first time the Australian government becoming the dominant funder of the system, when the Leader of the Opposition regrettably welched on his commitment to bring about fundamental reform. But we all remember what he said about the public hospitals. He said that come November 2007, having been Health Minister for 5 years, he was going to do something about it. He was going to do something about it. Mr Speaker, this Leader of the Opposition's credibility on health is in tatters. He gouged $1 billion out of the public hospital system of Australia. Mr Speaker, he put a cap on the GP training places for Australia. Mr Speaker, the Leader of the Opposition sat there as Health Minister while they abolished and continued the removal of the dental health scheme for Australia's seniors, leaving 650,000 seniors without a Commonwealth dental health program. Then, Mr Speaker, we had that promise of all promises, that rock-solid, ironclad guarantee about the Medicare safety net. Mr Speaker, where did that one go? Leader of the Opposition, where did that promise go?
Order.
Leader of the Opposition,
the member
where
for
did
North
that
Sydney.
commitment on
The
your
member
part
for
go?
North Sydney.
That principled position you put to the Australian people, or was that one of those ones where Peter Costello was saying quietly to himself, Tony, 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 whatever you do, if you go out there and promise all that, mate, I'm not going to be funding it after the election. And guess what happened? He didn't. So, Mr Speaker, rock-solid ironclad guarantee evaporated into a pool of water. Nothing happened. Now, Mr Speaker, we come to this question of the $1 billion. This is a really interesting point. We say he gouged $1 billion out of the system. What do we cite as our evidence? That noted purveyor of untruths, Peter Costello. Peter Costello's budgets of 0304, 0405, 0506, 0607 and the Ford estimates for 78, we have one figure after another of money being gouged out of the system. So what is his defence on this? It goes to the question of indexation. Mr Speaker, under the previous healthcare agreement, his predecessor had an indexation clause of 6.3%. That was based on a calculation about the costs in the system. And so in the subsequent healthcare agreement, which this Minister for Health, the now Leader of the Opposition, presided over, he reduced it to 5.3%. He gouged $1 billion out of the system. And he pretends, Mr Speaker, that that is not a gouge out of the system. I'd say to the Leader of the Opposition, is he seriously arguing that the costs of the hospital system went down? Leader of the Opposition, are you suggesting in that 5-year period that the cost of the hospital system went down? It's a bit like saying that if you're an age pensioner and you're depending on 25% of Matawi as the basis for indexing your pension in the future, and then suddenly you have a government which reduces that to 24%, and that's not a gouge on the pensioners. Mr Speaker, this is a $1 billion gouge out of the health and hospital system of Australia. Mr Speaker, this is the system that the Leader of the Opposition, then the Minister for Health, left this government with. That is why we have acted to invest with a 50% increase in the health and hospitals budget. That is why we have acted to deal with the shortage of doctors and nurses. And, Mr Speaker, the Leader of the Opposition said this. He said, I don't claim to have been necessarily the world's greatest health minister. Well, Mr Speaker, he may make that claim. He may make that claim. I can say to him this, Mr Speaker, he will go down in history as Australia's worst health minister.